Hi everyone, welcome to my channel. My name is Portia and today I'm going to give you an example of how to counsel your clients on general family planning method during your NMC practical exam. I know most of you are preparing towards your NMC practical exam and some of you are so anxious because you don't know how to go about it. When I was going to write my NMC practical exams, I had similar challenges. Even though the componentals was explained to me, what goes into rapport creation, the procedures were explained, I was still looking forward for someone to demonstrate to me how I'm supposed to do it on a D-Day. So getting closer to my practical exam, a sister guided me and I had a clear understanding. So today, I'm also here to give you an example of how to counsel your clients on general family planning method during your NMC practical exams. So my client is not here, my examiner is also not in our midst, so I'm going to be doing the talking alone. I also have here my family planning methods. So these are the family planning methods that I have. Can we get started? My client is already seated. Okay, please, you are welcome. I believe you are comfortable where you are seated. Okay, so my name is Adri Portia, a final year student from Whole Nursing Training College. Please, may I know your name? Okay, Sister Esther. So today I'm writing my practical exams and my examiner is also in our midst. He is here to assess me on the things I've been taught over the years in school to see how I'm going to put them into practice. During our discussion, if he has something to say, he may pause me and step in. So please do not be disturbed if such thing happen. I also want to assure you that everything we are going to discuss here today is going to remain here. So if there is any information or anything you think I need to know to make our discussion today successful, please don't hesitate to tell me. And also during our discussion or after our discussion, if there is a need for the third person to step in, you will still be informed before such decision is taken. Okay, thank you. So today we are going to learn about family planning, and I believe you've heard about family planning before. Okay, so please tell me, what do you know about family planning? Okay, there are measures we take to prevent unwanted pregnancy. Okay, so please, is that all? Have you heard something bad about family planning? Maybe someone said when you do it, this happen. You haven't. Okay. So today, just as you said, family planning, there are measures we take to prevent unwanted pregnancy. You are right. There are also measures we take to bring space in between our children and also give birth to our desired family size. So this is what family planning is about. We are going to look at the importance of family planning. When we do family planning, how does it benefit us? So please, what do you do? Okay, you're a trader. Please, do you have a child? One, a girl. Okay. How old? 5 years. Okay, so when you do family planning, you have enough time to go about your business and make enough money and also give quality education to this child and spend quality time with your family. And how does this benefit the nation? The more we plan our family, the more faster this nation also grow. So these are the few importance of family planning to us, our family, and to the nation. Okay. We have two types of family planning. We have artificial family planning and we have natural family planning. With the artificial family planning, there are methods that involve the use of drug and devices, but the natural family planning method does not involve the use of drug, does not involve the use of devices. It's just about understanding your fertile signs and to know when you are most or least likely to get pregnant. Under the artificial family planning method, we have one that you can do for a short period, another for a long period, and the final one is a permanent method. That one, when you do it, you won't give birth again. So under the short-term family planning method, we have non-original. It's an injectable and it works for 1 month. We also have Depo-Provera. It's also an injectable and it also works for 3 months. What they do is that they make your cervical mucus thickened, making it difficult for the sperm to move to meet the egg, and they also prevent ovulation. Still under the short-term family planning method, we have what we call the daily oral contraceptives. These are pills you take every day and at the same time. You are supposed to take it every day and at the same time to maintain hormonal consistency, because once you take it at different time, your hormone level is likely to drop, and once that happens, you are likely to get pregnant. These daily oral contraceptives also prevent ovulation. Now, we also have condom, and this is the only family planning method that protects you against sexually transmitted infection and pregnancy. Now, moving to the long-term family planning methods, we have implanol. It's a one rod that is inserted under the skin of your arm and it works for 3 years. We also have Jadel. Jadel is a two-rod. It is also inserted under the skin of your arm and it also works for 5 years. But if you want to take it off before 5 years, you can just come back to the facility and they will do it for you. They also prevent ovulation and they also make our cervical mucus thicken, making it difficult for the sperm to move to meet the egg. And also under the long-term family planning method, we have what we call the IUD. It's a T-shaped device. It is inserted through your vagina into your uterus. They make the environment hostile for implantation and they also prevent the sperm from meeting the egg. So that is what we have under the long-term family planning method. And with the permanent family planning method, it's either your fallopian tube are cut, are tied or sealed. And once this happens, you won't be able to give birth again. Under the natural family planning method, we have what we call lactational amenorrhea, and this method only works for breastfeeding mothers the first 6 months after birth. So if you've not given birth, you are not doing exclusive breastfeeding, you know that this method won't work for you. We also have what we call the cycle base. The red here indicates the first day of your menstrual cycle. The brown beads indicate days that you are likely to get pregnant. And the white beads indicate days that you are likely to get pregnant. The arrow, this black thing here is showing, it's having an arrow on it, which is showing the direction in which the ring should go. So the first day of your menstrual cycle, wherever the ring is, you move it to the red beads and you keep moving towards the direction in which it's supposed to go. When the ring gets to the brown beads, there are days you are unlikely to get pregnant. And when it gets to the white beads, there are days that you are likely to get pregnant. And this cycle beads work for people whose menstrual cycle are between 26 to 32 days long. So if your menstrual cycle does not fall between 26 to 32 days long, cycle beads won't work for you. We also have what we call the basal body temperature. When you check your temperature every morning before you engage in any activity, our temperature decreases slightly before ovulation and increases slightly after ovulation. So once you keep checking your temperature every day and there is a slight increase in your temperature, then you know that ovulation has taken place. Therefore, you are in your fertile period. So these are all the family planning methods that are available here. So please, among all these methods, please, which one will you go for? You go for daily oral contraceptives. Okay. So earlier on, I said I was going to pause at a point and do some explanation. So my client has chosen daily oral contraceptives. At this point, I'm going to ask client what she knows about this method, why she chose this method, ask her about her reproductive goal, like when she wished to start her family. I'll also have to counsel clients on everything she needs to know about this daily oral contraceptive, including the side effects. Also tell clients that in case she goes home and she's taking this pill and she faces some challenges, she should come back to the facility. She may know people who are also on this daily oral contraceptive and had the similar challenge she is also having now. She should not seek advice from them. She should come back to the facility and lodge complaint, because what works for them might not work for her, because our body works differently. So it is important for you to inform clients that whilst taking this daily oral contraceptive and she faces some challenges, she should come back to the facility and report. Now, you have to ask clients if she's having any question for you. If she's not having any question for you, then you have to ask clients questions like, what did we learn today? How are you supposed to take this daily oral contraceptive? Then clients will also show you how she's supposed to be taking this daily oral contraceptive. Then you provide clients with some of these daily oral contraceptive and thank clients and bid goodbye. Also, don't forget to do documentation in her card. Thank you. Don't forget to subscribe. Don't forget to like my videos for more.